Hello, everyone, and welcome to another episode of Common Sense with Dr. Ben Carson. I'm your host, Ben Carson, and today I'm honored to be joined by a truly outstanding pediatric neurosurgeon, Dr. David Sandberg. He's a professor and chief of pediatric neurosurgery at UT Health Houston and Children's Memorial Hermann Hospital. He has trained at some of the premier institutions around the world, has spent decades treating some of the most difficult neurosurgical conditions in children, but also serving abroad in countries with limited access to good care. Excitingly, he has a new book out called Brain and Heart: The Triumphs and Struggles of a Pediatric Neurosurgeon. It's a gripping, in-depth look at what goes on behind the scenes, leading to the operating room and even what goes on in the operating room. And David, we're so pleased to have you here and honored. Thank you for being with us today.
Dr. Carson, it's a huge honor. You've been an inspiration to generations of children who are interested in neurosurgery or many other fields, just doing better for themselves. And it's my honor to be here with you.
Well, thank you so much. You know, I remember how hectic life was as a pediatric neurosurgeon. What inspired you to find time to write a book?
You know, Dr. Carson, as my career progressed, as you did, I accumulated amazing stories, patient stories that I thought should be told. And I used to write down some notes when something incredible happened. That was one thing. The other thing is, you know, as pediatric neurosurgeons, we have so many difficult conversations with patients and families about the most difficult subjects, life and death things. Imagine telling a parent that their child has died or has a brain tumor. These are hard conversations. During these conversations, I choose my words very, very carefully. But I've often thought it might be beneficial for parents to hear exactly what I'm thinking. There are so many books that are written from the patient perspective, but few that let you into the mind of your child's doctor. And that was my goal in writing this book.
Wow, that's pretty special. Now, what led you to the field of neurosurgery and specifically to pediatric neurosurgery?
Yes, Dr. Carson, as you know, there are some neurosurgeons who know they want to be neurosurgeons from the time they come out of the womb. I was not one of them. I knew I wanted to be a doctor. My father's an ophthalmologist, and he took me when I was in high school and college on a few medical missions to the Dominican Republic, to Jamaica, to Antigua, where I saw him doing surgery on patients that were blind or nearly blind, that if they were in the United States would have been treated long ago and had much better lives. And I saw how much good you can do as a doctor in general. In college, I became interested in the problem of homelessness, and I worked extensively with the homeless in college. And I thought that I would probably do something related to public health, perhaps be a primary care doctor in an inner city or something abroad. When I got to medical school, I kind of caught the bug when I realized how exciting surgical subspecialties were, and also when I witnessed the relationship between surgeons and their families. Families come with a concrete, very scary problem. Surgeons can offer a solution or can kindly, compassionately state that there is no solution, and I like those interactions. Then when I rotated on the neurosurgery service at your institution, where I was a medical student, Johns Hopkins University, the team was so incredible, and they were so kind to me, and they were so passionate about what they were doing that I decided this is what I should do when I grow up.
Now, where did you go to college?
I went to Harvard undergrad.
What do you think about what's going on at Harvard these days?
Boy, I think, there are a lot of challenges. I think that academic freedom is important. I also think protecting students, anti-Semitism should not be tolerated, neither should Islamophobia. These are challenging issues in our time.
No question about it. Now, what was your home life like as a child growing up?
So I grew up in North Miami Beach, Florida. My father was an ophthalmologist. My mother was a teacher, and she was an author of a number of books in the Soviet Jewry movement. There were Jews that were oppressed in in the Soviet Union as it was at that time, and were denied exit visas, who were trying to leave the country and were imprisoned. She wrote books documenting their cases. She was kind of a human rights activist. My parents instilled in me the values of service to others. And that was a primary value in our home, which I'm so grateful for, and which I'm trying to instill in my own children. I went to public elementary school, junior high, and high school. Um, and, my parents were very actively involved in my life, and they were wonderful parents. I was so fortunate.
Well, what do you think it was in your training as you rose to the rank that shaped your approach to patients today?
A lot of things, One is just learning to be compassionate by following the examples of the people I admired, including you, as a role model for so many at Johns Hopkins. Um, you know, so many look up to you and your incredible career and how compassionate you were as a doctor, and your book, Gifted Hands, which inspired, so many thousands of people to do better. I wanted to be a person who inspired people. I wanted to be a compassionate doctor, um, and done my best over the years.
I bet your parents were bursting with pride as they saw you rising through the ranks, going through.
I'm so proud of them, and I'm so grateful to them. Always will be.
That's fantastic. Now, why did you decide to call the book "The Brain and Heart"?
Yeah,
All of us neuroscientists believe that the brain is the key thing for everything. Why did you decide to call it the brain and heart?
yeah. So when you think of brain surgery, at least I think of the incredible power of the brain. You think of the incredible functions the brain has, and you think of precision, and you assume that we have it all down to a science with all the fancy technology and toys that we have in the operating room. But what I learned over the course of my training and over the course of my years of practice is that there's so much of what we do that is not well defined by medical literature. And we have to make decisions with our gut and sometimes with our heart. And when I talk about the heart, I'm of course not talking about the organ that pumps blood through the body. I'm talking about the heart in the metaphysical sense, as a center of our emotions, a center of love. And we deal with a lot of heartbreak in neurosurgery, dramatic highs and dramatic lows. So, and I think it takes heart to be a good doctor. So those were the things that went into the title. And then, the title is Brain and Heart, the Triumphs and Struggles of a Pediatric Neurosurgeon. As I said, there are real highs and real lows. We get to save someone's life, and that's a magical feeling.
Mm.
And then we are humbled when, a child dies despite our best efforts, or has a worse outcome than we would hope for due to surgical complications or things beyond our control. So it's a humbling specialty as well.
No question about that. So many emotional situations. I remember there was a child who had metastatic medulloblastoma. It spread everywhere. And she was such a brave little girl. And her parents were falling apart. And she was like the family therapist for them. It was pretty amazing.
Incredible.
But you've had a lot of great stories. Is there one in particular that sticks with you even to today?
I mean, there are so many patient stories. I think one patient that profoundly impacted my life, in so many ways, that I wrote about in the book, is a little girl named Marcella. I was doing surgery um, in Honduras. I was volunteering as a resident and down there for a month, and I saw things that you should never see. In the whole hospital, serving over 1 million people, there were 4 ventilators. And if you weren't lucky enough to be on one of those ventilators, if you needed one, your family was bagging you with a mask at the bedside, and you would either live or you would die. It was incredibly tragic. And I saw hosts and hosts of children who were dying of diseases that we could treat in the United States. And I felt horrible, and I also felt so lucky. And for some reason, this little girl captured my heart because she was so adorable, but she had something that was so treatable, a type of tumor that we can cure in the United States. With the help of my mentor, We brought her to the United States, and we were able to cure her. And it's a long story. She wound up becoming somebody very important to me personally. I'll leave it to the readers to read the rest in the book because it's kind of a magical story.
Wow, it is a magical story. Now, a lot of people don't really understand what it takes to achieve what you've achieved. Can you, particularly for our young listeners, tell us what it takes from high school to become a pediatric neurosurgeon?
Yeah, I want to say, first of all, that in no circumstance throughout my life, neither in high school or college or medical school or residency or beyond, am I ever or have I ever been the smartest person in the room. I have often been the hardest working. I have been willing to sacrifice for my goals because, it's worth it to miss a party if you have to study for a test. If getting a good grade on that test is going to make you a more competitive applicant to go to a good medical school, and then you get to do the kind of things that I've been able to do in my life, I've been so fortunate. So the goals, what I would say to young people is, first of all, find what you're passionate about. Find a dream. The second thing I would say is extra points if that passion involves helping other people, because when you help other people, you get rewarded 100-fold in your own happiness, in your own life. And the third is, once you find that dream, go after it and do it with utter passion, and it is worth it, the sacrifices that you would make. Those would be the main things I would state.
Great. Now, not everyone has read the book. I hope a lot of people will read it.
Thank you.
And they'll have the answer to this next question. What was a typical day like for you?
Yeah, as you recall from your own incredibly busy career, um, many days are quite hectic. You are being pulled in 1,000 different directions. There are planned surgeries that need to be done. In the meantime, there are emergency surgeries that can come on top of that. When you get out of the operating room, there are patients waiting to be seen sometimes on the wards who've come in through the emergency room. There are 100 to 200 emails in your inbox waiting to be returned, many of which are important. They're patients inquiring about your research studies from around the world, or patients related matters, or other related matters, administrative, that can be important too. You have to manage your time very efficiently. And then there are other days that are more quiet. Kids get a cold and all of a sudden a big surgery is canceled and you have a block of 4 hours that is opened up in your day. The clinic days are stressful because usually I would have 40 or more patients in my clinics, and you want to make each patient and their family feel like they're the only patient you have that day. And that's a challenge because you also don't want to keep other people waiting. So
Yeah.
long days that pass by so quickly because there's so much to be done.
Now, you write candidly about surgical complications. Even great surgeons are going to have complications no matter what they do. How do you process emotionally outcomes that are unexpected?
Yeah. So my opinion is that there are different extremes. On the one hand, I could say, you know what? I'm a well-trained neurosurgeon. I trained at some of the finest institutions in our country. I performed this surgery to the best of my abilities. There's a bad outcome, but the same thing would have happened if somebody else had done the surgery, and you kind of wash your hands of it. I think if you put that little thought into it, when a child is worse off after an operation, you probably shouldn't be a doctor at all. On the other extreme, there are some doctors that are so paralyzed by complications that they doubt their abilities. They're unable to go on and offer the right surgery to the next patient who has a challenging diagnosis. I don't think that serves them or their patients well either. So there's some happy medium in between those two. What I do is I really enter deep analysis with a lot of sleepless nights about what happened and whether I could have done anything differently. Did I discuss the risks adequately in surgery? When I was in surgery, if something happened that I didn't expect, did I adjust properly? Because the risk-benefit analysis doesn't stop when you enter the operating room. You got to keep assessing that in surgery, and sometimes you need to change your plan. Is there anything I could have done better or differently in any portion of it? And then you have morbidity and mortality conference where you get to present that case in front of many, many people. It's like your worst day of your year, and it's presented with slides and videos, and there's your boss is there, and students are there, and people you don't know are there. But it's a very important process, and it's one to be taken very seriously because it can prevent harm to the next patient.
Now, you were also involved, in addition to vigorous clinical activities and laboratory research. You did a lot of research on tumors, brain tumors in children. And it's a devastating diagnosis. But can you describe the unique challenges of tumors in children compared to adults?
Yeah, I mean, first of all, you mentioned a child that touched your heart who had medulloblastoma. Um, Having a child with a malignant brain tumor is such a tragedy. And, some of these tumors can be cured, but the road is so hard for these kids with surgery and then radiation and chemotherapy and all of the things that wreak havoc on their bodies. And then, despite all those efforts, some children, don't make it despite, those efforts, and it's an absolute tragedy. I'm not the most brilliant scientist in the world. I had one idea that I think was a good one, um, to infuse drugs in the space where that tumor starts in the back of the brain called the fourth ventricle. And tumors often recur in that space as well. And by giving local drug delivery in that space, you can avoid some of the side effects of drugs that circulate around the body through normal means, and obtain very high drug levels, which can hopefully kill tumor cells. Um, we started in animals and did safety and toxicity studies, and I was proud that my idea made it to clinical trials. And I was principal investigator of a number of clinical trials. We helped some kids. There were some kids whose tumors melted away and who had a longer survival than expected, but we didn't cure anybody. It was incredibly humbling. And in the book, I write about how it affected me emotionally because, it does affect the surgeon emotionally when you put your heart into it and the outcome is not what you want. And these research patients doubly so because we would not only do surgery on them, they would come back for infusions, which I or my teammates, my team members, our physician assistants would give. And I would see the patient back week after week, infusion after infusion. And then I would hope and pray that the MRI scan after those infusions would show a response. And when it didn't, which happened so many times over and over again, my heart was broken over and over. And going and having those conversations with those
Mm.
families was absolutely devastating.
But so many times those failures lead to success later on because we learn things from them. We learn what not to do, or we learn what things create complications that we can avoid. So in the long run, I think they lead us to where we need to go. And people like you who engage in that research are a big part of success.
Well, thank you. And I think it additionally provides hope to families. These are families whose children have failed every treatment modality that's a standard of care. And we were showing them that no stone would be left unturned, and we were not going to give up on these kids.
A lot of times people wonder about how do you keep your kids safe? A lot of things that we deal with trauma. Do you have some tips for parents of little children? And tell us what your opinion is of things like football.
Okay. First of all, obviously children need to be in car accidents are one of the biggest causes of morbidity and mortality in our country in children. And kids need to be in an age appropriate car seat. And then as they get older, they got to wear their seatbelts. I recall, and that includes in the middle seat, I recall one severe head trauma patient I took care of who I'm still in touch with today, who was the only patient in a car full of 5 teenagers who was not wearing a seatbelt. She was in the back seat in the middle. All the other 4 kids were fine, and she had a devastating head injury, made a miraculous recovery, but she was in the hospital for 4 weeks, had brain surgery, went to rehabilitation, missed most of a year of school, and thank God she turned out to be okay. But that one case always struck me. Seatbelts are imperative. Bicycle helmets. I see kids riding around the streets on bicycles without helmets. I want to go up to every one of them and tell them, please, please wear your helmet, because I've seen so many devastating injuries and deaths from kids on bicycles hit by cars, but I haven't seen a serious head injury in a kid wearing a bicycle helmet.
Mm.
Those kids all weren't wearing helmets. Gun safety. I live in Texas. There's a lot of guns here. You know, I'm not going to get into Second Amendment things. I think people should have the right to bear arms. It's in the Constitution. That's fine. Just lock up your guns and keep them safe. Have a gun safe. Keep them away from children. I've seen children as young as 4 years old who have had self-inflicted gunshot wounds to the head, or little kids who find a gun and shoot their sibling. They will never, ever recover emotionally.
Right.
Please lock up your guns if you have them. And then you get to the more controversial things like football. If you have 50 neurosurgeons in a room and you ask them, would you let your son play football? You'll get a variety of different answers. I'm personally cautious. I would not let my son, who wanted to play football because of all the things I've seen: cervical, spinal cord injuries, concussions. I worry about chronic traumatic encephalopathy. There's some controversy in that one, so I'll leave it at that.
Well, what did your son think about that?
Well, my son, he's a good soccer player and he's happy to be on the soccer team. And he knows that his dad's a neurosurgeon and that's his misfortune.
Well, I want to get into another area that has a lot of different opinions. It's tough work what you do, and it requires a lot of training, a lot of learning, a lot of long nights, all-nighters, all kinds of things going on. And then a couple of decades ago, everybody was concerned about it, and that was the origin of the 80-hour work week for people in training, 88 hours for neurosurgeons. Good or bad?
Yeah, I think there were some days in my training where I worked so hard and was up all night and then was up all night the next night. I honestly loved residency training. I trained in the era before work hour restrictions. I was learning so much. We were saving lives. I was so passionate about it. What I see in this generation, there are some amazing, neurosurgical trainees in this generation, but I do worry that mistakes are made more often by handoffs, by poor communication, than they are by a tired resident. I didn't see that many, if any, mistakes made because somebody was tired, but I've seen a lot of mistakes made by poor communication. And I worry about ownership of patients. When I was a resident, the attitude was, that is my patient and I'm not leaving the bedside. I'm not leaving. I don't care what time it is or whether my shift is over. There are no shifts. I don't even know what that is. And I think that instilled a passion and a caring and a responsibility that is a very important value. So,
Yeah,
I'm more old school, and if it was up to me, the work hour restrictions would not be what they are.
I agree with you 100%. I remember a lot of times many long, long, long hours, and you would go to get a nap in the restroom, the resting room. and But we had an agreement: if something really rare or exciting happened, you'd come and wake the guy up, and so you never really missed anything. And it was didn't do any harm to do that, and it really trains you for those marathons that will come up during your career.
Yeah,
So
agree.
now, how did you navigate the tension between professional demands and personal or family life? You hear
Yeah,
so much from the young people today about quality of life.
yeah. I'm so fortunate. I have two amazing children. They're 17 and 14. Um, One of the things I'm most proud of, my wife is actually a physician as well. She's an ophthalmologist who specializes in ocular oncology. She is one of the busiest ocular oncology practices in the country. So we are a busy pair. One
Mm.
of the things I'm most proud of an accomplishment over the last few decades is not just my neurosurgical career, but my role as a parent. I was a 50-50 and have and continue to be a 50-50 parent. I changed half the diapers. I, would come home from work and get on the floor and play with the kids and loved every minute of it. I think, you know, I never missed a major event. I never missed a birthday celebration or anything because you can design your schedule so you're not on call on the most important days. I have missed plenty of soccer games for my son. And um, hopefully they see that I'm doing something important and that I'm present when I'm there. I'm so fortunate. The kids have turned out amazing. So whatever we're doing is working, or we're extremely lucky.
Well, it really makes a difference when that's a priority for you. And it was a priority for me too. I was so busy though, it was ridiculous. And then I was traveling a lot as well. But I made it a requirement when I traveled somewhere that my whole family come with me. So all the kids had frequent flyer cards for every airline. They
That's
traveled
amazing.
all over the world. So it was, we had some really good times, some bonding times. But I've noticed now that my kids are obviously older than yours. They're all married. They have kids of their own, but they spend a lot of time with their kids. And I think the message got through to them. So it was
Yeah,
good.
amazing.
Now, have you ever had a time when you came close to burnout? You hear that term a lot in medicine.
I actually haven't. I think I'm so fortunate that I really did a good job picking a career that I'm passionate about. And in the years that I've been a pediatric neurosurgeon, I have absolutely loved my job. Sure, there's days I'm tired, but I don't experience burnout as a physician.
Well, how do you preserve your mental and physical health? Do you intentionally do anything?
I mean, I'm very efficient and I'm very focused on the things that are important to me, and I eliminate things that are not important. I try not to go to useless meetings, and I focus on doing my very, very best to be engaged with patients, which lifts me up. Anything that I'm going through, any tiredness or anything, pales in comparison to the personal struggles that my patients and their families are going through. And then when I'm outside of the hospital, I'm with my children and my wife, and I'm happy with them. So I'm happy at work, I'm happy at home, and I don't have time for much else besides, my home life, work, and exercise.
Well, you've done everything exactly correctly, it seems. But recently, you were diagnosed with young onset Parkinson's disease. How has that journey changed your perspective, being a patient yourself?
Yeah, we think of ourselves sometimes as being immune to to the things we treat, but we're not. We're humans like everybody. And some months ago, I started developing a tremor of my right hand. The hard thing is that it was very mild and it was only at rest. So it wasn't affecting me in the operating room at all. My surgeries were going well, and nobody even noticed in the operating room that I had a tremor because when my hands are in motion, it's not visible. And that's what you're doing when you're in surgery. But it started to become more noticeable. I saw three neurologists, outstanding individuals. And, Dr. Carson, I never wanted to be one of those neurosurgeons who stay on too long, who operate past their prime, just like athletes who sometimes are incredible professionally on the field. And then you kind of cringe in their last few years because they're not as good as they used to be.
Or
I
like
never thought,
politicians?
I never, I never thought that would happen at age 53.
Yeah.
So, it's been a hard year. It's, to be honest with you, very hard to make the decision to give up a career that I love so deeply. Um, Very hard to tell my children, very hard to tell my parents, my sisters, my patients and their families who had a vision of me taking care of their kid throughout their childhood.
Yeah.
Once I got past those things, it's been incredible how much love I've received, support of my family and my children, support and love from parents, of patients, an outpouring of love that has lifted me up. And I've really shifted to gratitude. I'm grateful that this happened in my 50s instead of my 30s or 40s. I'm grateful it's this instead of some of the worst diseases like malignant brain tumors that I treat. Hopefully, I have a long life expectancy. I'm grateful that my symptoms are relatively mild, that I have my faculties. There's so much to be grateful for.
Well, with your neurosurgical career, drawing to a close, what do you plan to do now? Writing, teaching, serving in other ways? What?
Well, for the next few months, I'm focused on this book. My book tour is really exciting. But then, I thought a lot about it. There are many who would do something within the field of neurosurgery. I'm a one-trick pony. I've been doing this for 27 years, and I don't know how to do much else. But when I thought about what I'm passionate about at work, there are two things that stand out. One is the operations. I love the operations, the technical aspect. And the harder the operation, the more exciting. Deep brain tumors are my passion. Um, I can't do that anymore. But the only thing that trumps that easily is a passion for helping children, and particularly children who are less advantaged. We see so many social ills, and I can still help with that. And so I'm actually going back to school. I'm getting a master's in social work at the University of Houston. I'm enrolling in the fall. And my goal is going to be to pivot to something completely non medical, to work with children who are impoverished, perhaps the homeless population, perhaps children in foster care, children who are disadvantaged. I've been given so much in my life, and I still have more to give back.
Well, I can tell you the skills and the knowledge that you've acquired will equip you to do virtually anything. I have a friend, he's passed now, but he trained as a neurosurgeon and he developed a tremor. And he said, I'll go to law school. And he became the president of the American Professional Liability Lawyers Association.
Oh, wow.
So his medical knowledge, of course, didn't serve us in neurosurgery very well.
Right.
But he was a very interesting fellow. But I found in the area of politics, uh, learning how to evaluate things based on evidence and to be multifaceted gives you a great advantage. You might want to consider something in the political field yourself too. We need logical people helping to guide this country, and it was designed in a way that people from all fields could participate. And what a great advantage it is when people with scientific backgrounds who evaluate facts and don't just operate on emotion uh, can make. But a last question that I have for you is, what do you want readers to walk away with after reading Brain and Heart?
I think it depends who the reader is. If you're a medical student or a neurosurgery resident or even a high school student trying to decide what you want to do with your life, this provides a real window into my mind. And I hope this helps you decide, is being a physician or being a surgeon or being a neurosurgeon, is it really for me? Am I made to have these conversations, to work these hours, to do these procedures? So I hope it's helpful in that regard. For parents of children who've had neurosurgical diagnoses or other diagnoses, it doesn't have to be neurosurgical. I hope that this window into my mind and into my soul is meaningful to you and provides some perspective, a different perspective on what your family and your child has gone through. And then, more peripherally, for those just interested in medical drama and medical stories, I hope this is entertaining for you and useful and hopefully inspiring. I mean, the biggest thing is, I hope people, I like when people help other people. I think it lifts up the people they help, and I think it lifts themselves up. So if this book inspires, anybody to do anything that helps another person, then I will have accomplished a major goal.
Well, thank you for your willingness to share it. I'm sure it will impact a lot of young people who are trying to decide what they want to do. They may not all want to become neurosurgeons, but I think it'll probably send a lot of people into the field of medicine, recognizing what a rewarding existence that can be, but also realizing that it's quite challenging. But sometimes that's what people want, a challenge that allows them to do something that's good. So thank you for being a wonderful representative of our profession as doctors.
Thank you, Dr. Carson. It is such an honor to talk to you. You have lifted up thousands and created different lives for thousands and thousands of people. And your legacy is just an honor to our field, and it's just a tremendous honor to share this time with you. So thank you so much for having me on your podcast.
Wonderful having Dr. Sandberg here. Brain and Heart, The Triumph and Struggles of a Pediatric Neurosurgeon by Dr. David Sandberg. It's available now wherever books are sold. A remarkable story which really gives you a behind-the-scenes look at the life of a man who has dedicated his life to saving others. Well, that's it for today. And please subscribe, Apple Podcasts, Spotify, wherever you get your podcasts, and spread the word. Common sense is not common anymore, but it can be if we all do our part to spread the word. And remember to rate us, review us, and tell all your neighbors about us. And until next week, make sure you treasure the cornerstones: faith, liberty, community, and life. See you next week.